Hello and welcome to the Arc Woman podcast. This is an exploration of womankind. Here we discuss what it is to be a woman in the modern world while utilizing ancient and modern modalities in tandem to create a bounty of health for the body, mind and spirit. Hello, welcome to the podcast and welcome Jaclyn. How are you today?
I'm well, thank you, Sarah. Thank you so much for inviting me today.
Thanks
I
for
really do
having
appreciate it.
Yeah, thanks for being here. Honestly, this is a much awaited podcast. And research is me search, basically. Like I was diagnosed with ADHD kind of mid this year and I'm 29. And then I did a deep dive because I was like, sometimes my symptoms are worse and sometimes they're better. Like,
Yeah.
what is up with this? And so then kind of fielding that to the community I have and then finding out that there are a bunch of women who have the same questions that I did. So yeah,
Mm.
thank you so much for being here.
Oh, it's my pleasure. I'm very
Yeah.
excited.
I'm excited too. Let's get into it. Just to
Yeah.
start off and do some introductory questions, can you please tell us about your background and what inspired you into your journey of psychology?
I'm a psychologist by background, and from as early as I can remember, I would be sitting on park benches at the beach on holidays, and I'd have people come up and sit next to me, and I'd be very curious about their lives. And I think that curiosity has really been the thing that's inspired me to find out about the inner workings of people, and I'm very curious about that. So I think that's probably what's motivated me and maintained the hyper focus on psychology for as long as you need to in terms of the study that we have to do, because that's definitely not in line with my usual attentional span and focuses. So, yeah, that's probably in a nutshell why I am a psych and why I'm here today, really.
Hmm. And so going on from that, what motivated you to focus on ADHD? You did just say before you're like my own attention span, like do you have ADHD or experiences of ADHD?
Yeah. I have experienced ADHD hyperactivity my entire life with a formal diagnosis after my first bub postpartum. So that it, I particularly loved working with clients of neurodivergence, especially women, before my formal diagnosis. But I feel like in many ways we're kin in the experiences we've had, and I feel that lived experience is so vital for the work that we do therapeutically with our clients. I think that until you've lived this, you don't quite understand it. And I feel that's where we can add the most value to our clients, that we have lived experience. We're there with you in the trenches and experiencing both the benefits of ADHD, but also the challenges that we encounter as well.
Mm.
So,
You were
yeah,
just
that's
talking
what.
about some of your lived experiences of ADHD, but like before we even get started, for people in the lay audience who might not even understand what that is, could you please define ADHD and highlight a few of its key characteristics? You did just say a few of them then, but maybe just give
Yeah.
us a really solid definition to form that foundation before we get into the nitty-gritty, intricate parts of it.
Yeah, okay. The one thing that I really work hard on in the work that I do with clients therapeutically is the psychoeducation around it. So I love this piece. This is my jam. But really, what we want to understand is that ADHD is a neurodevelopmental condition, and it affects how we process information, regulate our attention, and control our impulses. So it doesn't mean we don't have the ability to attend to things. It just means it's impacted, and the regulation of our attention is impacted. So it's not just about like being inattentive or distracted or hyperactive. It's much more kind of complex than that. So it's about differences in our brain function and our behavior. And I, especially in the work that I do, we see it that ADHD exists on a spectrum, and it can vary really significantly intra individually, but also between individuals as well. And I think that's where it's really important for us to honor each individual experience, even throughout the lifespan of one individual as well. So it is chronic, and that's something that's really important. And they manifest as we have certain experiences and life changes and hormones, but we have different presentations of that throughout our lives. Does that clarify it, or do we need more detail?
If you could give me like some concrete, this is what I see in most women who have ADHD, like symptoms, or like give me an example, like doom piles are everywhere. It's one of the ones that I know.
Yeah. If only you could see my desk right now, then I could affirm for you the concept of do piles. But really, when we look at it from a clinical perspective, there are three potential diagnoses. So there's ADHD with inattentive presentation, hyperactive presentation, or combined. So when we look at that from a clinical perspective, we're looking at inattentive symptoms would be like difficulty sustaining attention, really with tasks that require sustained mental effort. So, reading, following instructions, listening to directions, frequent forgetfulness, losing items that are really necessary for tasks that we need to do functionally on a day-to-day basis. So, keys, wallets, paperwork, etc. Appearing distracted or a bit spaced out, even when we are trying to focus, is another really key symptom of inattentive ADHD, and struggling with time management and organization. Then we have the hyperactive impulsive presentations. So that's feeling like you're being driven by a motor, even if you're feeling exhausted. That's a really, really common symptom I see in women, and restlessness, constant feeling of needing to be on the go. Then perhaps interrupting conversations, blurting out answers, struggling to wait for your turn, or at times interrupting conversations or someone else's train of thought. At times, acting without considering long term consequences. That can often be described as impulsive, and fidgeting, tapping excessively, and that physical restlessness. But the one thing that I find particularly interesting in women that present with ADHD is that a lot of their hyperactive, impulsive symptoms are internalized. So it's very much around ruminatory thoughts, intrusive thoughts that they can't control, and very, very active internal thoughts and dialogue. And then we look at our combined presentation, and that's a mix of both of them.
Mm. Thank you for that. And I realized as you were saying interrupting, I've already interrupted you twice. And I was like, I remember mentally taking a note of that and being like, don't do that.
It's also the story of my life. So it's probably going to be a lovely dynamic between us today.
Cool. And it's interesting when you do it, people think you're really rude. And it's like, oh no, I'm just really excited to talk to you and I want to connect. And that's all it
Yeah.
is. Yeah.
Yeah. It's the passion. It's that beautiful kind of connection and depth that I feel like neurodivergent individuals, especially women, bring. And that's why I mentioned it's a strength. There is a lot that we can leverage if we manage the shadow aspects of it too.
Beautiful. I love how you
Yeah.
said that. Thank you so much for just kind of playing out three of the main things that you see and attributing like characteristics and behaviors to it. I think that's so helpful. Could you please extend on that and tell us what symptoms and characteristics and behaviors that women exhibit that maybe you don't see in men? Like, is there a difference between how it's presented between the sexes?
Absolutely. And just when we consider the differences in presentations, it's really important to remember that the DSM, the criteria that we actually refer to when we're looking at diagnostics around this, was typically, if you look at the references on there and who contributed to it, it's typically white Anglo-Saxon males. So really being aware of that, and where the data is yielded from in order to actually create the criteria is really useful to explore. Um, and I could talk about that all day, but I know it specifically wasn't the question, but I think that's a really important thing to remember, that the DSM criteria really reflects that of your Anglo-Saxon white male. And it's more about, when we're talking about the presentation of symptoms in men, which I'll touch on just briefly, is really around the externalized symptoms. So hyperactivity and impulsivity, that real physical restlessness, disruptive behavior in the workplace or at school, depending on the age of the individual. And we often see that outward behaviors draw a lot more attention in earlier years. So that's why you generally see the diagnosis of younger boys because they're externalized and they draw a lot of attention from teachers, parents, peers in those earlier years than with females.
Mm.
So if we touch on the symptoms of females, a lot of those are more internalized, like I spoke about before. So we're more likely to exhibit inattentiveness, emotional dysregulation, perhaps, and feelings of overwhelm and a general sense of just not being able to get on top of things, rather than the physical hyperactivity. And it may be that we appear more daydreamy or scattered rather than disruptive.
Mm.
Um, then there's the emotional sensitivity. So clients often report the heightened emotional sensitivity, including the frequent swings and trouble managing frustration and feelings of inadequacy, which is that real imposter syndrome that we also experience, or the rejection sensitivity dysphoria, um, really kind of playing havoc with our actual experience of the reality of our situations. Then we've got masking behaviors, which is something that is predominantly what I see in many of my presentations with clients as well. They often are better at masking their symptoms as women using compensatory strategies, and it makes them appear organized and focused, and that can really delay the diagnosis as well.
That was kind of going into my next question because everything you're saying just then, and when I was kind of loosely diagnosed by my psychiatrist, she was like, yes, you show symptoms, but the DSM-5 is based off of white Anglo-Saxon men. So technically, I can't diagnose you, but you show all of the symptoms that we would see in a woman, but the DSM-5 hasn't caught up yet. So then my next thinking was, okay, so many women must be getting diagnosed late and then being misdiagnosed, probably with anxiety and depression. Is that correct?
Yeah, yeah. If I were to look at the data of the work that I do with my clients, many of them are in their late 30s, early 40s, coming to me with a historical psychiatric history of anxiety and depression. And then one of the really wonderful things that have recently been created is a questionnaire for masking. And that allows us to look at the typical Anglo-Saxon white male presentation in the criteria, but also identify where are we at with masking and how much of that is influencing the actual outcomes on our general diagnostic assessments of ADHD in women as well.
Mhm.
So that that creates a very profound experience for women when they do get that diagnosis. And I'm doing everything in my power to educate women about exploring it earlier. So perhaps they don't have those misdiagnoses because they often come to me and say, it just never hit the spot. I just never felt heard. I didn't I felt like there was something more going on. The sense of overwhelm I feel every day just isn't my anxiety and depression. There's something else going on.
Mhm. Mhm. Yeah, thank you for that. And that kind of leads me into my next question, because we will talk about this, how dopamine is attached to estrogen in some ways, and that can impact how we present. So, do life stages like pregnancy or menopause intensify or even reveal ADHD symptoms? Because you said that you were diagnosed after your first bub, which is when you don't have as much estrogen around. And I've heard of psychologists being like, I'm getting an influx of women who have just had their first child who are all of a sudden exhibiting ADHD symptoms that they didn't have before. And same thing with post-menopausal women as well. So is this something that you see? And is this something that we also see reflected in the data?
Yeah, it's something that we're seeing, and I wish that we had more longitudinal studies to give us the data. But anecdotally, I'm seeing it and hearing it almost daily. Every time I practice, I'm hearing it. So if we consider, like, there's a whole lot of societal and cultural expectations. There's the previous misdiagnoses and treatment that are almost cloud what's going on for women and perhaps lead them down different paths. And that's what we find. We find that they've been navigating what feels like quite an overgrown path of confusion in terms of their psychiatric health, and then kind of going, oh, well, I've been diagnosed with ADHD now, and I understand, and the light kind of comes at the end of this journey, and they go, oh, all of this really makes sense. And when we look at the key factors presenting the symptom presentation, it's it's quite a few factors at play, and it's quite dynamic. But if we have a look at the presentation of early adulthood and the adjustments and adaptations that are required, if we have a look about the symptoms that might be happening in early adulthood, for example, that transition brings on increased responsibilities, and it highlights ADHD related difficulties. And the way that many people in that kind of early adulthood group present time management problems, emotional burnout, lots of imposter syndrome, and memory issues during that time. And if we then progress into motherhood, that can magnify the
Yeah.
ADHD symptoms. So you've got all of these hormonal impacts, which is so profound, but you also have an extraordinary amount of extra mental load, which is creating overwhelm, a sense of overwhelm and disorganization, forgetfulness, emotional sensitivity, task paralysis, especially if you're in an attentive presentation. And if we actually kind of even capture what societal expectations are on mothers, and that they are organized and nurturing, that can really exacerbate feelings of inadequacy at that time. And sleep deprivation and stress. If I were to say what the biggest impact on ADHD symptoms were outside of the hormonal aspects in our cycle, it would be sleep. So that it's almost like a breeding ground for ADHD symptoms at that time. And then if we look into menopause and midlife, then we're looking at the estrogen levels declining during perimenopause, and then in menopause, and that can make ADHD symptoms more pronounced. So we see worsening inattention, uh, difficulty with emotional regulation, energy fluctuations, and really significant identity shifts, which are quite profound also in the motherhood space too.
Yeah.
So I hope that kind of captures what as a woman we're navigating through our journey of life, and then the ongoing demands associated with all of the experiences we have, and then the adaptations we have to make whilst also experiencing these symptoms, which are actually exacerbated by our biology and our life experiences and stresses at the time as well.
The only constant with a woman's body is change. And so that's the thing. Even when you're in your cycling years, I feel like I'm for different women throughout the month. And I feel like it's such a beautiful thing. And when you tune into it, it's such a gift. But I feel like women already, if they don't have ADHD, they're at odds with that because we're taught to be static. And then we go through motherhood, and then you have, don't have any sleep. You have this perfect environment that is a breeding ground for ADHD. And then you're like, what the hell is going on? I should be so in love with my baby. Why do I feel so disconnected? Why am I not sleeping? And, and it just kind of creates this snowball effect. And then you get anxiety, depression, all of these other things that kind of latch on to that ADHD experience as well. It's so sad. And then women are lost and they're left alone to figure this out on their own. So, yeah, hopefully, if anyone's listening to this and they've just given birth and they're like, I have ADHD, all of a sudden, like, you're not crazy. It's just the experience you're going through, and it's completely okay.
Yeah. And I just really want to kind of reach out to those women, whether it's, you don't necessarily have to be a mother to have an emergence of these symptoms. And this can come up in any stage of life. And it's likely that you've had ADHD the entire time as a woman, but you have employed, and you are the most ingenuitive individual to have employed so many strategies to mask and to compensate. And that's something that I really try and honor with my clients, because I don't know anyone else on the planet that could actually create this degree of buffering around them that allows them to function in that static nature, that static way. And then we see the burnout. We see the burnout ensue. And it's about educating women around, almost like a wave is coming and going, and going with that instead of fighting against it, and educating them about the dynamic around that. And it's quite interesting because I supervise a lot of early career psychologists, and many of them are neurodivergent, and many of them are really impacted by their cycle. And we have really lengthy discussions in supervision about how we can work with that cycle and setting up their calendar around that and managing client work around that as well. But I know that's another topic.
I just thought I'd slip in here and have a quick rendezvous and talk about a few of the questions that were fielded to me from the poll that we just didn't get time to touch on in this podcast. So the first one is, how do estrogen and progesterone affect ADHD medications? Do women need to adjust dosages throughout the cycle? So as we were learning about just before with Jaclyn, estrogen and progesterone, they have significant impacts on ADHD symptoms, and therefore it does have an impact on ADHD medications. And women have found, both in studies and even through anecdotal, stories I've heard from other women, saying that they've found that they needed to adjust their dosages throughout their hormonal cycle because of the fluctuations between estrogen and progesterone. So let's get into that. Estrogen, first off, tends to increase the effectiveness of ADHD medications, particularly stimulant medications like Ritalin and Adderall. So estrogen enhances dopamine activity in the brain, and by its ability to bind dopamine at its receptor site, and it tends to upregulate its production. So estrogen equals more dopamine, right? Which means we have this increased focus and attention when we have estrogen around, which is in that follicular and ovulatory phase. So this tends to make ADHD medications far more effective during the follicular and ovulatory phases when estrogen is around. On the other hand, progesterone dampens the effectiveness of the medications. So progesterone has a calming sedative effect, and it reduces dopamine receptor activity, and it upregulates the production and binding of GABA to neuroreceptors in the brain, which has the opposite effect of dopamine. So this can make ADHD medications less effective during the luteal phase when progesterone levels peak, and particularly even the menstrual phase, like the first half of your menstrual phase. And so what we found in the literature for dosage adjustments is when we're in that follicular and ovulatory phases, ADHD medications work far more effectively and no dosage change may be needed. But when women are in their luteal phase or even their early part of that menstrual phase, women may experience reduced medication effectiveness. So adjusting that dose and maybe increasing it may be effective. So lower doses are less effective during this phase, while higher doses could compensate for progesterone's impact on dopamine. I have to say this though, it's really essential. If you have ADHD, if you're on medication, you have to work closely with a healthcare provider to monitor your symptoms and make adjustments. Don't just listen to this and say, this health provider on a podcast said this, I'm going to do this. This is just informational. I'm a nutritionist and I've specialized in women's health, but I'm not your nutritionist. I'm not your women's health specialist. Jaclyn is an amazing psychologist, but she is not your psychologist. So again, just remembering that aspect of this podcast, and this is just for informational, just so you know that, I have noticed that my ADHD medication isn't as effective. Now I have this information, I can go to my healthcare provider, have a conversation, and we can adjust the dosages. Another really interesting question I had was, do women on the autism spectrum or ADHD tend to start their periods earlier than others? And the research suggests that yes, women who are on the spectrum, the autism spectrum, so ASD, or have ADHD, tend to start their periods a little bit earlier than others. One study found that girls with ASD had a higher likelihood of early puberty, though the exact mechanisms are not fully understood. And just in the science we have today, we still don't fully understand why some people get their periods earlier than others. It has a lot to do with the anti-Mullerian hormone in the body, and another hormone that regulates estrogen and progesterone as well, and it kind of dampens their effects and stops FSH and LH and even gonadotropin releasing hormone from activating in our hypothalamus. For some reason, with women who have ASD or ADHD, we tend to get that early activation of the hypothalamus to produce FSH, LH, and therefore estrogen and progesterone, and therefore get your periods a little bit early, which kind of makes sense because ASD and ADHD occur in the brain, and when we get our first menarche, that's activated in the brain as well. So It may be related to hormonal differences or how the brain processes sensory and physiological signals related to puberty. It might also have something to do with trauma as well, which we will be talking about in this podcast. So we've also seen this with ADHD. And so similar patterns have been observed with women with ADHD and girls with ADHD, where they tend to experience menarche earlier. And research is actually now suggesting that hormone imbalances and differences in brain development in seen ADHD women may contribute to that early onset of puberty. So we see some studies as well that propose hyperactivity and impulsivity are also associated with ADHD, may influence how the body responds to puberty hormones, which I think is really interesting. Another question that I got over and over and over again is, okay, we hear a lot about this gut-brain axis. Is there a connection between gut health and ADHD, especially in women? And the answer to that is an absolute resounding yes. So there is a growing body of research that highlights the connection between gut health and ADHD, particularly in women. We do see it in men, but we see it more so in women. And the gut-brain axis refers to that bidirectional communication between the gut and the brain, where signals are sent back and forth via the nervous system, hormones, and the immune system. So let's go into that a little bit more. So the gut microbiome includes trillions of bacteria and other microorganisms, like even viruses, fungi, and yeast to a certain degree. And we need them around because they influence brain function by promoting and producing neurotransmitters like serotonin and dopamine. Like I was saying before, they're really, really crucial for mood, focus, and attention. When we have an imbalance in the microbiome, which we will usually call dysbiosis, it disrupts this process of creating these serotonin and dopamine and all these other neurotransmitters, and therefore impacts our mental health and perhaps the exacerbation or the appearance of symptoms, right? Also inflammation. So both ADHD and gut health are linked to inflammation. Chronic inflammation in the gut can lead to systemic inflammation. So chronic inflammation means low-level inflammation that occurs over a long period of time, and systemic inflammation means it's going out towards other aspects of the body. It's not just in the gut anymore, it's going out to other parts of the body, which may impact the brain and worsen ADHD symptoms. So in women with ADHD, especially those who have comorbid conditions like anxiety or depression or even PMDD, you're going to be a lot more sensitive to inflammation, basically. And when we're talking about inflammation is a tool used by our immune system, and 80% of our immune system lives in the gut. So if we're talking about inflammation, you have to focus on gut health. And then there's an aspect between that estrogen and gut health as well. So in women, hormonal fluctuations, especially fluctuations in estrogen, can influence gut microbiome composition and gut motility. There is this part of the microbiome called the estrobloom, and it talks about how estrogen influences our gut and the gut microbiome community there. Estrogen promotes a healthy microbiome, but when it fluctuates, like when we expect those during the hormonal cycle, pregnancy or menopause, it can impact gut function, and in turn, it will influence ADHD symptoms as well. Also leaky gut, also known as, that leaky gut is what we use in lay terms. If you said that in a doctor's office, they might turn up their nose at you. The official word is intestinal hyperpermeability. So basically, it's where we have tiny little holes or gaps in the tight junctions of our epithelial cells. So we're supposed to have all of these cells kind of like brick and mortar, right? They're creating this beautiful barrier between us and the microbiome, so we can absorb food and then we can excrete waste, and we only take in what we need and let go of what we don't. But if we have inflammation, we're going to have some leaky gut, which means the tight junctions between these cells are loose and other things can get through. So this means that women with ADHD, if you're experiencing gastrointestinal issues like bloating, indigestion, or food sensitivities, it can be a sign of this, because this condition allows undigested food particles, toxins, and microbes to enter the bloodstream. And this is going to trigger an inflammatory response. And then that's going to exacerbate ADHD symptoms because of that gut-brain axis. And then also talking about dysbiosis and leaky gut and neurotransmitter imbalances. So imbalances in the gut to lead to altered production of neurotransmitters like serotonin and dopamine, which we both need in balanced amount, especially if we have ADHD. So since women are more likely to experience certain neurotransmitter imbalances like lower dopamine, specifically in ADHD, dysbiosis is going to further compound and worsen the symptoms of ADHD. So what can you do? Number one is gut healing, right? So focus on eating foods like prebiotics, which are rich in fiber, and probiotics. So probiotics are the bugs, so the healthy microbiome bugs. Prebiotics are the things that feed it. So there are some fibers in foods that we don't actually access or benefit from. It's only there to benefit the microbiome, which is prebiotics. So making sure you're eating high fiber foods. You need to be eating about 30 to 40 grams of fiber every single day. Some people say 20 to 30. I like, especially if you have ADHD, to increase that because that's really going to make sure your gut microbiome is super robust. So making sure you're eating lots of avocados, beans, rice, high fiber foods like apples, dates, sweet potatoes, especially in that progestogenic phase, because we need to be supporting serotonin and dopamine production. Lots of B vitamins also helps too, but we want to be eating fermented foods. So kombucha, kefir, water kefir is really yummy. Coconut kefir is really yummy. Dairy kefir is really yummy as well. I'm not so about integrating like kind of high yeasty foods like kombucha or sourdough in this time, especially of ADHD, because I feel like the estro bloom can get a little bit out of whack, especially with ADHD. But that's just kind of what I see in my clinic. Take with that what you will. And then the next thing is addressing food insensitivities or sensitivities. So many women with ADHD have sensitivities to certain foods, and I see this a lot. So gluten and dairy, and even eggs to a certain degree, and beans. So beans that haven't been properly made. So you need to be soaking them for a long period of time and cooking them properly and putting them with cumin so you can actually digest them and take away that phytic acid that's attached to the protein that can exacerbate symptoms of food sensitivities and leaky gut. So making sure that you're identifying and eliminating the triggers and then slowly incorporating them once you've bound up your gut lining with things like zinc and even L-glutathione. These things are really great. Omega-3s are really great for this as well because they decrease the inflammation in the gut. You can't really heal any type of leaky gut or intestinal hyperpermeability unless you've addressed what's inflaming this area, taking away what's inflammatory, adding things in that are anti-inflammatory, and then giving your body the ingredients like zinc to reform those intestinal tight junctions so you don't have leaky gut anymore, basically. As I was saying before, omega-3s, so you can take 2 to 3 grams a day, which is 2,000 to 3,000 milligrams. And so fish oil supplements are going to be great. So have a high level of EPA and DHA, which are also, really positive for ADHD because it's been shown to improve focus, attention, and impulsivity. I did say also zinc. Zinc is really important for the development and synthesis of dopamine in the gut, right? So that first phase of creating dopamine. And you need to be having at least 30 milligrams a day. So supplementing with 15 to 25 is really great. Zinc citrate or zinc picolinate is also great. Magnesium, I've said this a lot in every single part of my content. I talk about magnesium. Really important for regulating neurotransmitter activity. So managing stress, hyperactivity. So magnesium glycinate, that's the one that's most well absorbed. It's gentle on the stomach and it's also going to help with any type of leaky gut or food insensitivity. And you can take 200 to 400 micrograms a day or milligrams a day. Next is iron. So we need iron because it supports dopamine production, and low iron's been linked to worsened ADHD symptoms, particularly anxiety symptoms, because we do see an overlap between anxiety and low iron, which, I talk about in my hormonal birth control podcast. So if you're interested in that, go listen to that podcast. But I don't recommend supplementing. I'm really anti-iron supplementation unless you absolutely need it. I have a few women in my clinic who are like, I just get mouth ulcers or I have other things happen when I don't take my iron. Okay, that's fine. If you were going to supplement with iron biglycinate is okay. I'm just saying because iron is used by pathogens in the gut, and if you already have leaky gut, it can worsen it. So before you supplement, please just try and get it from whole foods, legumes, red meat, even seafood like oysters. Going to be really, really great. If you wanted to incorporate things like beef liver and beef liver supplements, that's awesome. If you did really want to supplement with an iron supplement, never go over 18 to 20 milligrams a day. So the next one is vitamin D. So vitamin D is really, really helpful for women with ADHD. So Vitamin D receptors in the brain are involved with dopamine regulation and neurodevelopment. And when we have deficiencies, we have poor focus, mood instability, and cognitive challenges. And then if you wanted to mix it together, D3 with K2 is really amazing. K2 is really important for brain function too. And you can take up to 5,000 IUs of vitamin D a day. That goes up and beyond what the RDA, at least in Australia, is. But I've done a bunch of research. Dr. Rhonda Patrick is really great to look into this when she talks about vitamin D. She's done lots of research on this and found that there's not really an upper level for vitamin D. It's really well utilized in the body. There's not really any dangerous side effects associated with huge amounts of vitamin D anyway. And you'd have to have so much vitamin D to start getting upper limit negative aspects associated with it. So don't go past 5,000 IUs. Try and get it from Whole Foods, of course. But supplementing with that and K2 is great. B vitamins too. So I was just talking about B vitamins before. Really, really important for brain function and neurotransmitter production in the gut. So B6, super important for dopamine and serotonin. B12 and folate is really important for mood and cognitive function. So if you take a B complex supplement that includes B6, B12, B2, and folate in their methylated forms, that would be great. I really like the Ethical Nutrients brand, the Super B. I think it's called Super B or Mega B. It's always super or mega with them. So you can follow the dosage on any label though, but you want to have, 50 to 100 milligrams per day of B6 and B12. Next is L-theanine. And so this is an amino acid that you can find in green tea. It promotes relaxation and focus, and it boosts alpha brain waves, and it helps to calm down hyperactivity and improve attention without sedating you. And you can take this in a supplement, so 100 to 200 milligrams a day. And next is NAC. So NAC helps to balance glutamate and dopamine in the brain. And that's been shown to improve mood, reduce impulsivity, and enhance cognitive function in ADHD. So you can take 600 to 1200 milligrams a day of that. And I'll also add on here as well L-tyrosine. So L-tyrosine is an amino acid that is the backbone of dopamine, and I've been supplementing with this. I have ADHD and I found it incredibly helpful. I take 500 milligrams in my follicular and ovulatory, and then I take 1,000 to 1,500 in my luteal and menstrual. I haven't been going up to that 1,500. I've just been trying to stay at that 1,000, and I found it so helpful. This cycle, I haven't noticed that I've lost my keys or my phone, which is kind of a telltale sign that I'm going to get my bleed soon and my dopamine is low. It's actually been a lot better, and my partner even said that the other day, and I was like, okay, it must be the L-tyrosine. So hopefully this answered a few of your questions and gave you some really concrete feedback on what supplements you can take and what you should do, how you should eat for ADHD as well. So let's get back into the episode. Oh no, you're speaking my language. I'm always saying that to women, especially if they work for themselves. I'm like, if you can plan out your month, especially if you have ADHD, to go, okay, this is where I have the best communication skills. This is where I know I'm going to hit burnout, and I need to integrate a little bit more rest and recovery and reflection. And so maybe let's talk about that ebb and flow. Could you please explain maybe that connection between estrogen and dopamine and how that impacts on ADHD and its symptoms, characteristics, and behaviors?
Yeah, absolutely. So when we understand the dynamic between these hormones, we know that estrogen plays a role in dopamine regulation. So dopamine and ADHD are crucial at controlling attention and impulse regulation. And these are domains that are typically impaired in individuals with ADHD. And low dopamine levels can exacerbate ADHD symptoms. And those are generally the symptoms that we see in difficulty focusing, impulsivity, inattention, those types of things. So as a woman engaging with a natural cycle, estrogen levels fluctuate throughout our menstrual cycle, and we know that it peaks around ovulation and then drops before menstruation. So when estrogen levels are higher during that follicular stage, many women with ADHD notice improved concentration, mood, motivation due to that increased dopamine activity. I would even go as far to say that I see women anecdotally reporting to me that they may experience more hyperactivity during that time, more hyperfocus during that time also, and less rejection sensitivity and less kind of sensitivity or emotional dysregulation during that time as well. So if we were looking at it, that would be the time to be more engaged in social activities or in more dynamic, extroverted type of activities as well. Um, and then conversely, during that luteal phase, when estrogen levels fall, dopamine regulation decreases. So that may make your ADHD symptoms worse, leading to increased difficulty with that focus and emotional regulation. So,
Mm.
like in that luteal phase, we're talking about quiet work, detail oriented things, organizing, deep cleaning, creating, um, more internal based activities, which seem to work best in that stage.
I
Does that
always
help
know.
answer your question?
Yeah, it does.
Yeah.
Yeah. And it speaks to like a few of the behaviors that you might see. Because I know as soon as I'm getting my period in 2, 3 days, if I can't find my keys every single day, if I leave my house and I'm like, oh, where are my keys? Where's my phone?
Yeah.
Where's my wallet? I'm like, oh, okay, I'm getting my bleed in like 2 or 3 days
Yeah.
because my ADHD symptoms are like kind of playing up. And it has been really interesting to kind of play around with that as well. And also, could you please talk about maybe ADHD and its connection to PMDD? Because we know that PMDD only really appears in that luteal phase when we have that huge drop off of estrogen. We're not binding serotonin and dopamine in the brain. All of a sudden, we have all this GABA. And I think for women with PMDD, that switchover is really intense and it can give you mood swings. And a lot of women just say it's hell week. And I've seen a direct overlap. The women who have ADHD also have PMDD most of the time.
Yeah, yeah. I wonder if it's the chicken or the egg here,
Yeah.
because if I see a presentation of PMDD, I will screen for ADHD immediately. And so when I started noticing this in the early days, before it became kind of really apparent and common knowledge, there was a study in 21 that was released that basically indicated that, over 45%, I think it was, of people reporting ADHD, who had a diagnosis of ADHD symptoms, 45% of them were reporting PMDD symptoms and were formally diagnosed with PMDD as well, which I think is quite extraordinary. When you think in contrast, PMDD affects approximately 2 to 8% of the general female population. So to me, that was like so profound and speaks to the other life changes that also occur when we have our babies, when we birth, when we go through perimenopause and menopause as well. So in terms of my research, and I've deep dived pretty extensively around this from the psych perspective, the prevalence is not fully understood, but it's indicated that when we have a look at the hormonal fluctuations and the neurobiological aspects of ADHD, we see almost a heightened receptivity to premenstrual mood changes and ADHD related symptoms like also exacerbate the PMDD symptoms as well.
Mm.
So when when I see these types of symptoms, I I feel so much compassion for my clients because the impact of these two conditions in it that are interacting comorbidly have such a profound impact on their quality of life. And it's really crucial if you're listening to this and you're experiencing severe premenstrual symptoms to really speak with healthcare practitioners and those around you as well, because I've seen women's lives change when it's appropriately supported in
Mm.
this space. And you do not have to experience those symptoms to the severity and degree that you do, that it's really impacting your function. There is a lot of help out there and tailored treatment plans and things we can do to support.
Mhm. Before we move on, and I just even forgot to ask you, can you please define PMDD and also tell us what are the characteristics and behaviors that we see associated with this?
Yeah, it's typically the dysregulatory emotions and the emotional sensitivity. I don't even like referring to it as sensitivity. It's almost receptivity to what's going on around you because it's real, and it's valid. So if we if we take out all the DSM criteria and not speak so clinically, I think it's really imagine a line drawn in the sand. And that line is I can generally function in the 2 weeks to 1 week before my menstruation occurs. And if you are noticing impaired function in your social, occupational, home life, daily activities, and activities of daily living, then no matter what, I think you need to speak with a health practitioner about that because it doesn't need to be so severe and it doesn't need to be impacting you to the degree that it is. So the symptoms, emotional dysregulation, and typically that's the majority of what presents during that time. Increased tearfulness, hopelessness is a really significant presentation to the point where at times we do see increased suicidal ideations and increased thoughts about self-harm. We really need to be aware of those things. And if that is very different to how you would normally get a sense of yourself and a sense of how you feel in the other 2 weeks, perhaps, of the month, then that is something we do need to treat as an urgent health condition that needs support.
Absolutely. I think I hear this a lot in my clinic as well. Go, how are your cycles? And very often women will say, yeah, it's fine. Like my periods are fine. I don't experience any pain. I don't have any acne. My boobs don't get sore. And I'm like, okay, do you feel like you want to die after you ovulate? And they're like, oh my God, yes. I'm like, okay, so something isn't right
Yeah.
here. Like you have to keep in mind that your mental health and any PMS or PMDD symptoms and ADHD symptoms are also a biomarker, and it's your body's communicating something to you, and like that's something you need to pay attention to
Oh,
and
yeah.
place at the same level of importance as you do your physical and and psychological symptoms as well.
Yeah, absolutely.
Mm.
I speak with a lot of women and they're bleeding outside of their cycle and there's all of these markers going on
Mm.
and we're going you've got those markers and you're seeking treatment for those physical markers, but the suicidal ideation and the intense intrusive thoughts that almost you feel compelled by, you're not you're not seeing as another symptom, and those are debilitating and very extraordinarily distressing.
Mm.
Um, and we always hear about them secondary. Hey,
Yeah.
mm, yeah.
As we're going on that tangent, can we please talk about how ADHD and trauma are connected? And can trauma mimic ADHD symptoms? Because there seems to be a little bit of an overlap between these two.
Yeah, it's really interesting around the impact. I'm an EMDR practitioner, which means I practice in trauma quite often. And given I work predominantly in the perinatal space, I work with a lot of birth trauma and experiences women have had in their early years as well. And I have anecdotally seen that simply by being neurodivergent and the experiences that we have through schooling, through societal expectations, through the masking that we've had to engage in, there are exposures to traumas simply through that. But when we look at the connection between ADHD and trauma, it is quite complex and multifaceted, and the information's still out on whether trauma mimics neurodiversity and neurodivergent symptoms, or is it that we have the two existing comorbidly? There's still a lot of information that we need to get around that, and I'm pleased to say there's studies emerging. But with both ADHD and trauma, they can independently affect emotional regulation, attention, executive functioning, but when they co-occur, they can exacerbate each other. So that leads to even more heightened challenges, especially that's really relevant for women, as both conditions are often underdiagnosed or misdiagnosed as well, especially with some of the the misinformation about borderline personality disorder and experiences with trauma. We know that if someone has an experience of a diagnosis around of borderline personality disorder, that it really should be termed multiple complex trauma syndrome, and the stigma attached with those things. So I think there's not only the underdiagnosis and misdiagnosis, but also popular culture and how certain diagnoses are viewed as well.
Yeah. Going on from that, like, what are some therapeutic approaches to address both trauma and ADHD that don't overwhelm the nervous system? Because I've heard of a lot of somatic practices out here and I've seen them and I've heard stories from women who either have trauma, ADHD, or both, and they're like, that completely overstimulated me, maybe even re-traumatized me, maybe even made my symptoms worse.
Mm.
So, what are some practices that you'd recommend, or even just some behaviors that you would say? Like exercise, get enough sleep, I guess, are
Yeah.
probably two of the most important ones. Can you extend on that?
Yeah, absolutely. You're totally right. And I have come across a lot of clients that have used, cognitive behavior therapy through for their misdiagnosed anxiety and depression. And one of the things that I never quite understood is if we have trouble regulating our executive functioning system, and our and cognitive behavior therapy is about executive function, then CBT just doesn't cut the cookie.
Mm.
And it's and we see a lot of people that have engaged in CBT for their anxiety and depression. And then we engage in therapeutic modalities like EMDR, which has, if not better therapeutic outcomes than CBT in the treatment of trauma. And we see that EMDR helps processing that unresolved trauma. It reduces the emotional intensity. It desensitizes individuals, and it alleviates symptoms that do mimic and exacerbate ADHD, and the trauma-based symptoms as well. But above all else, it really is about the trauma-informed care that women who have ADHD and trauma, or trauma care, that it's so important that the people that you encounter that are there to support and care for you are trauma informed in their approach. And we know that therapeutic alliance is the biggest predictor for therapeutic outcomes, no matter what psychotherapy is utilized. So I think feeling heard, understood, cared for, validated are some of the most profound things that you can experience as a human, as a woman, and as a woman with ADHD, more than anything
Mm.
that we would do at a more kind of complex level like EMDR.
Yeah, and as someone who's done EMDR, it's groundbreaking. I cannot believe how
I
effective it is and how
know.
simple it is.
I
It's
know.
just such a wonderful practice. It blew me away when I first did it.
Yeah, and I think it's really important, like EMDR and the processes around it. Um, are not widely known. But if we consider and let everyone know that you actually don't have to relive the trauma like you might perhaps do if you were doing cognitive behavior therapy or exposure therapy, you do not have to relive it. There are different protocols to utilize in EMDR where you don't even have to speak about your trauma out loud if you choose not to. So that's really important to honor. And I think that's the most trauma informed approach that we could utilize. Um, and I think it's just quite profound. And that teamed up with a good therapist that's trauma informed and has you feeling heard and validated, um, that can be pretty life changing.
First of all, going on from that, how can women make sure that they find a therapist or a psychologist and psychiatrist? I'm trying to remember all the words.
Yes.
Who's trauma informed and specializes in ADHD? Because yes, someone can go and get a bachelor and do your master's in psychology, but how do you know that they've actually specialized in these things and if they're actually going to be a good fit for you?
Yeah, it's a really good question. I think the term specialized in, in any industry needs to be considered with caution. And I think that, there's not a lot of like formal professional development out there for the subject of ADHD. You'll see lots of little training programs pop up. It's nothing as formalized as what you would do with EMDR training or as regulated with the EMDR training. I think that the most important things to consider is that if finding a psych, and this may sound and make some people laugh, but it's like finding a soulmate, honestly, because it and it's about giving it some time. You certainly don't expect to date and find your soulmate in the first instance. And so understanding, doing your due diligence, of course, and exploring where their skill set is. If they say they do, they treat 20 different presentations, it's probably someone you don't want to work with simply because you want someone that has seen clients and worked with clients in this space often. And it's really just about like when you go, if you were to get a surgical procedure done, you'd want the surgical procedure done by someone who's done the procedure over and over and over and over again. The same thing goes with a psychologist. So when we consider that, it's about making sure that above all else, you have a good therapeutic alliance. And that sometimes takes 3 to 5 sessions to really get a vibe with and giving yourself that time and giving that feedback. If a psychologist isn't there asking for feedback informed treatment from you, then you really want to be looking elsewhere because feedback informed treatment is so important. How did you feel heard today? How did you feel understood? What can I do differently? Is such an important question to be asking therapeutically. We are not the masters of you. We do not know you as you know yourself. And so we want to be guided by you and what works best for you as clients. And I think have if you have ticked all the boxes in terms of your research and exploring that they have experience with ADHD, understanding how many client presentations they may have seen, and many admins that generally in practices will be able to answer those questions for you. Or perhaps you could ask for an initial session with the psychologist just to get a feel for their work with you and how you feel you connect with them as well.
Yeah, I think that's a very foreign thing for women because we're so used to going into the doctor's office and being like, I have this hormonal issue. And they're like, just take the pill. And so it must be very weird, I think, for women who have these issues with ADHD and going, oh, I can ask my therapist to do something differently. Oh, that's so interesting. And I can say that this isn't working for me and I can go to someone else. So that's really beautiful. Thank you. Just stepping back again and just talking about the diagnoses of women with ADHD, we have seen an increase in women being diagnosed officially with ADHD. Why do you think this is increasing and specifically in women?
I think that there are lots of factors at play there. If we consider the general popular culture right now, there's a lot of chatter about it. You pop on TikTok or Instagram and you see that there's a lot of discussions around those things. But I really love that and adore that and honor that because when we're seeing an increase in diagnoses, we're seeing the breaking down of misinformation, misdiagnosis. We're seeing that people are starting to really identify and understand what is impacting them and how they can reach out for support. So when I consider those things, it's like when the left-handedness of individuals hasn't actually increased, but when it became more acceptable within schooling systems to write with your left hand,
Yeah.
more people came out as lefties. It's not that it didn't exist. It's not that it wasn't prevalent during that time. It's that we are exploring that and more accepting of that. And to me, it's a great thing. To me, it's not that we're seeing it pop up everywhere and it's being overdiagnosed. I don't think that that's at all the case.
Okay, cool. So that was my next question was, do you believe ADHD is more prevalent or we're just diagnosing it better? And you just think we're just diagnosing it better, and that's why we've seen an upregulation in diagnoses, especially in women.
Yeah, yeah. Like we've got improved like diagnostic tools and resources, absolutely. When we talk about some of the best practice tools that we utilize to assess this now, we've got some really good um, robust psychometrics that support that. We've got some great tools that help us identify any masking as well. There's a better awareness and understanding, the reduction of stigma, and there's more research on adults and women as well. So when there's also the diagnostic bias correlation, like historically there's been biases in medicine and psychology, and it was often that women were overlooked and attributing their struggles to the anxiety and the depression or personality traits like such as borderline personality disorder rather than considering it as a neurodevelopmental condition. So the shift towards addressing that biases definitely has led to more women being accurately diagnosed, which to me is something that should be absolutely celebrated.
Yeah, fucking hallelujah. Like
Mm,
women are getting the answers finally.
yeah, finally. Yeah.
Yeah. So what would you recommend? What are the next steps that women should take if they are suspecting a misdiagnosis of anxiety and depression? If they've listened to this and are like, you know what? Yeah, I agree with a few of these traits. I don't think I have anxiety or depression. I think I have anxiety or I think I have ADHD. How do I go forward and try and find a diagnosis?
Yeah, I think the best place to look really is reflecting on your experiences and really reflecting on your symptoms and understanding how ADHD manifests in women and starting to note some of those down. Journal, reflect on it, understand when it might be that the symptoms are amplified. And is that linked to your cycle? And then I would definitely explore gathering information, understanding the symptoms, what those types look like. There are self assessment tools that can be utilized. Um, for example, things like the adult ADHD self report scale and ADHD related scales for women that are quite easily accessible. And I would strongly suggest keeping a symptom diary. So, documenting situations where you struggle with focus, organization, impulsivity, like noting those patterns, like I'd mentioned, any triggers or impacts on your daily life. That will be extraordinarily helpful when you go to speak with any practitioners about exploring a diagnosis, having all that information available. And if you're one of the 46% that may have a comorbid PMDD condition, that we get onto it ASAP,
Mm.
especially with symptom diaries. And then consulting the correct specialist. So start with your GP, explain why you suspect ADHD, and provide examples from your symptom diary. And be honest about your struggles. This is where we remove the mask, right? And this is where we really speak honestly and truthfully about the challenges we're having and request a referral. Ask for a referral to a psychologist or a psychiatrist that specializes in ADHD. In my experience, the GPs are so saturated right now that they might not be aware of who that is. So perhaps going in armed and advocating for yourself would be really helpful. Or if you feel like you don't have the capacity because you're so burnt out, then perhaps bringing along a support person to help advocate for you and talking about a bit of an action plan before you go in with the GP. And then finding that health ADHD literate professional. So seeking out those clinicians. And it may be useful whether I provide you with some resources around how to access ADHD practitioners, and you could include that in any of the resources you share. Um, but really being aware of what it entails, I think you going in with your eyes wide open and making informed choices is really important. So, your GP can refer you to the psychiatrist or a psychologist. Generally, in order to access any of the psychotropic medication that is required as part of ADHD symptom management, if you choose to go down that route, generally, unless it's very specific circumstances, psychiatrists can only prescribe that medication. So generally, you would need a psychiatrist to complete the assessment and diagnose you with ADHD in order to access the medication if that's something that you're wanting to explore. Generally, what we see with psychologists is that we will support you with ADHD symptom management and the strategies around that. We can absolutely work hand in hand with a psychiatrist and GP, but generally, in my experience, the psychiatrist will want to at least do an informal diagnosis, if not have the psychologist do the formal diagnosis, provide that information through to the psychiatrist. But to be honest, Sarah, in my experience, I would say only 10% of women want to actually pursue the medication and are really happy to do preliminary discussions around an ADHD diagnosis and then work on the behavioral aspects of it. That
Mm.
might be because I work in the perinatal space and women who are trying to conceive or still breastfeeding are opting not to utilize stimulants as a treatment management strategy for ADHD at that time in their lives.
And I have heard that as well, that even women who haven't given birth yet and who are, even postmenopausal seem ambivalent around medication. And I will just say here, like ADHD medication, anti-anxiety and also antidepressants are life-saving medication. And I don't really have any type of qualm around the use of those medications. Maybe overusing them long term probably doesn't have good health outcomes for brain health. But you were just talking about a few of the different ways that you can help manage, ADHD symptoms. So what would you recommend to women with ADHD to help them manage their daily life, especially when their dopamine levels are fluctuating? I think you touched on it earlier before when you were like, plan out your month, know when your dopamine is going to be high, when it's going to be low, and act accordingly. But what are some other daily things that you'd recommend?
Yeah, it's such a good question because we're really looking for tangible ways to actually improve our experiences. So it's such a valid question. I think that the best place to start is building a dopamine friendly routine. Like we know the making sure you're hydrated, making sure that you're getting enough sleep and exercising, all of those aspects. But really kind of trying to leverage some of the things that drive us as unique individuals. So, building that dopamine friendly routine is something I speak about regularly with clients. It's about incorporating rewards. So, creating small, immediate rewards for completing tasks. Dopamine is then released. So, that's when we get that sense of achievement and pleasure. So, even something small like a fun activity after finishing a chore can help, or doing something you enjoy at the same time. So, perhaps listening to a podcast while you're cleaning or doing something that you don't particularly like. Um, if you're into gaming and exploring those types of activities, then gamifying tasks using apps or systems that make tasks feel like a game. So there's like to do apps with streak features and things like that, that breaking tasks up into smaller steps and checking them off provide a dopamine boost. So at the beginning of every day, I do a run through sheet through ChatGPT with tick boxes. And after every minute task that I do, I tick it off and I get a little dopamine hit. And then that actually keeps me engaged and motivated in my task and really helps me manage inattentive symptoms. So whether or not we can leverage some of those things. The other aspect, especially for those who have that general sense of overwhelm, is simplifying and structuring your environment. So the decluttering and organizing piece, the using external cues, because object permanence is a bit of a challenge that we have as an ADHD symptom. So visual reminders like sticky notes, alarms, whiteboard calendars can really help you stay on track. And prepping the night before. So, laying clothes out, meal prepping where you have the opportunity, organizing work items in advance can reduce that decision fatigue. And then really, I think the final piece is around like creating sustainable routines. Because oftentimes we'll say we'll do this, 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 and this, and it's way too extensive and unmaintainable. So tying new habits to existing routines, that anchoring habit piece, time blocking, so having specific blocks of time, and starting small before our unrelenting standards kick in, perhaps, you know, really starting with one or two of the habits and building gradually instead of overhauling your entire routine.
Yeah.
Those are some really kind of practical strategies we utilize in the work that I do. And then also, it might be worth touching on working within your energy levels. That might be a really valuable place to start as
Mm.
well. Identifying your peaks, noticing when you're most alert and productive, and then taking breaks, using movement, stretching, mindfulness activities to recharge when you have that energy dip. And um, really trying to refrain from the negative self-talk and the dialogue that may ensue if you don't meet your own personal expectations as well are
I
really
think that's
helpful
something a
strategies.
lot of women suffer from because they're like, what is happening? I was so amazing last week, and now
Mm.
this week I suck. I'm forgetting everything. I'm dropping stuff. I haven't been able to focus, and it can kind of breed this really nasty internal dialogue that's just so corrosive. And I just think having that mindfulness around your cycle, just as a normal woman that doesn't even have ADHD, that you can't be in a perpetual bloom, babe, that like things are going to change, especially if you have ADHD, and just kind of going, okay, here is when I'm going to be social. Here is when I'm going to focus. Here is when I'm going to reflect. And here is when I'm going to rest. And even throughout the day, and recognizing when it's high and then when it's low, and just, you supporting yourself through everything you've just said, basically. And I think it's really interesting that I think everyone has that little thing where if they have a list of things to do, if they've done something that isn't on their list, you draw a little box and you
Oh,
tick
got
it
you. Got you.
because you want that dopamine. Yeah.
Yeah. Yeah. How can you refrain from not?
Yeah,
Like
I do it every single time. And I'm like,
I just
yeah,
watered the plants. It wasn't on my list. I'm going to tick it off and write it down.
little treat for my brain.
Yeah, absolutely. Absolutely. And I think just like if there's no other key message today, it's just really about honoring yourself. And we know that women who try and perform in a way that their intuition and body is telling them that they don't currently have the capacity to do, that we see extraordinary boom bust cycles and extraordinary burnout. And especially as we navigate through life's responsibilities and demands, um, the burnout can ensue a lot quicker than it may have when we might not have had kids or when our capacity wasn't taken up by other mental demands or physical demands. So if if we were to just honor ourselves and where we were at in our cycle, in our symptoms, and not push through those things, I think we would be seeing a lot more well women.
Is there anything else you wanted to add to before we close up today?
No, no, I think the yeah, honor yourself is probably the most important message we can have to these extraordinary women out there that are functioning in a neurotypical society with just the most unique, extraordinary brains. Um, honor it.
Yeah.
Mm.
Accept yourself and love yourself for who you are and know that you are normal and
Yeah.
lovable.
Oh, absolutely.
Yeah.
And I think that's an important thing to remember. Like you are adored, you are loved. Remember that no matter what your brain says to you.
Beautiful. Thank you so much, Jaclyn. And before we close up, where can people find you?
You can find me through my website at www.bloom-psychology.com.au. So that's BLOOM-psychology. I'm not on socials currently. It's on my to-do list that I haven't yet gotten the little dopamine reward from ticking off. But you will be able to find me and my team there. And if you are looking for any support in the ADHD space, even if you'd like to just flick through an email and explore what you should be looking for, you are always welcome to reach out to me. Any person that I can support in this space, please reach out. I'd be more than happy to help.
Beautiful. Thank you so much for being on the pod. And yeah, hopefully everyone else has a beautiful day.
Yes, thank you so much for your time, Sarah. I
All
appreciate
right.
it.
Thanks for being on.